There's a quiet confession you'll hear in hospital break rooms, usually over cold coffee. They call it a silent squeeze, not because it's rare, but because it traps people who think they're doing everything right. You take the little pill every morning, your numbers look good on paper, and then 3 months later, your doctor quietly nudges the dose upward. Sound like a familiar loop? If that stung a little, stay here. Over the next several minutes, I'm going to walk you through the real biological driver behind most stubborn blood pressure problems, and a series of 5 movements that, done daily, can help your body relearn how to regulate itself. Picture waking up 1 week from today. No dull throb at the base of your skull, no mid-afternoon fog. Your home monitor reads 120/80. Not because you just took something, but because your system handled the root cause on its own. Right now, millions of people are simply managing numbers, not restoring health. They check the cuff, adjust the prescription, tolerate side effects, while the underlying issue sits untouched. By the end of this video, I'll reveal the single mistake that can make this entire routine useless, even if you follow every step perfectly. And it's not what you'd guess. Stick around for that. My name is Dr. Kevin Adawelo. I've spent over 20 years in cardiovascular medicine. Let me be crystal clear from the start. Nothing here is about tossing your medication. That conversation belongs to you and your doctor. What we're doing is addressing a physiological blind spot that most prescriptions never touch. Here's something your typical checkup probably never mentioned. Your brain, that 3-pound supercomputer, makes up only 2% of your body weight, yet it demands 25% of all the oxygen you breathe. Every minute, without exception. The brain doesn't store oxygen. It needs a continuous river of blood flowing up through vessels in your neck. Arteries carry fresh oxygenated blood to the brain. Veins carry the used blood back down toward the heart. When those veins get compressed, even slightly, even partially, blood begins to pool in the head. Oxygen delivery dips below the brain's required threshold, and the brain detects this instantly. Here's the insight that reframes everything you thought about high blood pressure. Your blood pressure isn't a disease, it's a message. The brain sends a direct order to your heart: increase the pressure, force more blood through, compensate for the bottleneck. In the vast majority of cases, your pressure isn't rising because your heart is failing. It's rising because your brain is demanding it, because something is squeezing the vessels in your neck, and that something is rarely a tumor or a massive plaque. In most people, it's chronic muscle tension, the posture you've held for decades without ever noticing. But before we touch a single muscle, there's one preparation step that doubles the effectiveness of everything that follows. Blood viscosity, how thick or thin your blood is, directly affects how easily it flows through narrowed pathways. Dehydrated blood is thicker. Thicker blood needs more force to push through any compressed space. So here's the morning ritual. Immediately after waking, drink 350 to 450 milliliters of warm water. Not cold, not room temperature, warm around 45 degrees Celsius. Warm enough to feel it slide down, not hot enough to burn. Your daily total is simple. Multiply your body weight in kilograms by 20 to 30 milliliters. If you weigh 80 kilograms, that's 1.6 to 2.4 liters per day. Why warm? Because warm water signals your parasympathetic nervous system, the rest and digest branch, to relax the walls of your blood vessels. Cold water does the opposite. It triggers microconstriction throughout your vascular tree, including right in your neck. Let that sink in. 25% of your oxygen, one urgent signal from the brain, and a compensatory pressure loop that may have been running on autopilot for years. Now, let's locate the first muscle. Reach up and feel the sides of your neck. Go ahead, do it now. Find the 2 thick, rope-like bends running diagonally from just behind your ear down to your collarbone. Those are your sternocleidomastoid muscles, or SCMs for short. Anatomically, each SCM wraps directly around the bundle of vessels that feed your brain. When they are chronically tight, from stress, from screen time, from decades of health tension, they act like a slow, progressive clamp, not cutting off flow completely, just squeezing enough to reduce venous return by 15 to 20%. Just enough for your brain to say, more pressure, please. Research published in the Journal of Physical Therapy Science found a direct, statistically significant link between SCM tension and elevated arterial pressure in adults over 45. The connection wasn't subtle. Here's how to release it. Sit upright, feet flat on the floor. Place your right hand on the left side of your neck, just under your ear. Find the cord of the muscle. You'll feel it more clearly if you turn your head slightly to the right. Now use 3 fingertips to press gently against that muscle. Firm contact, not hard pressure. Slowly turn your head to the left, away from your hand. Stop at about 45 degrees. Hold for 3 seconds. Return to center. Repeat 5 times on each side. The sensation should be a gradual release, not an aggressive stretch. Any sharp pain, ease off immediately. Do this twice a day, morning and evening, no more. The tissue needs recovery time. If your neck feels a little tender after the first session, that's normal. It means the muscle has been holding tension without your awareness. That tenderness usually fades within 2 days. Now let me introduce you to a group of muscles that almost never comes up in blood pressure discussions. Deeper than the SCM lies the scalene group. 3 muscles on each side running from your cervical vertebrae to your upper ribs. Their main job is to help lift your ribs when you inhale. But here's the critical part for hypertension. The anterior scalene muscle wraps directly around the subclavian artery and the brachial plexus, the nerve bundle that connects to your sympathetic nervous system, your fight or flight response. When the anterior scalene is chronically tight, it doesn't just compress blood flow, it also activates your sympathetic nervous system, keeping it switched on for hours at a time. And the chronically activated sympathetic system keeps your blood vessels in a state of partial constriction around the clock. This explains why some people's blood pressure barely responds to relaxation techniques alone. The tension isn't just in your head, it's structural, mechanical, embedded in your tissues. Here's the scalene release. Sit upright. Place your left hand on the right side of your neck, midway between your ear and your shoulder, slightly behind the SCM cord, in that groove between muscle groups. Apply gentle inward pressure with your fingertips. Imagine pressing toward the center of your neck, not downward. Now, slowly rotate your head to the right, looking over your right shoulder. The key word is slowly. Take about 4 seconds to complete the full rotation. Hold at your maximum comfortable range for 2 seconds. Return slowly, 5 repetitions each side. Fast movements trigger a defensive contraction. Slow movements allow the tissue to release. Quick question for you. When you woke up this morning, was there any stiffness in your neck, even minor? Drop a number in the comments. 1 for none, 2 for mild, 3 for significant. I'm tracking this across our community and will share what the pattern shows. Now here's something that genuinely surprises most people. Not all the vessels affected by neck tension are deep. The platysma is a thin, sheet-like muscle that covers the entire front of your neck from your jawline down to your collarbone. It's so thin you can barely feel it separate from your skin. But it sits directly over the external jugular vein, the main surface drainage vessel for blood, leaving your brain. Think of it this way. The internal jugular drains deep brain structures. The external jugular drains the surface. If the platysma is chronically contracted from stress, cold, habitual forward head posture, it compresses the external jugular. Blood backs up slightly. Intracranial pressure rises. and your brain responds by raising your blood pressure. When people describe that heavy, full feeling in the back of the head that comes with high blood pressure, surface drainage restriction is often a big contributor. Not the whole story, but a real part of it. Here's the exercise. Sit upright. Place both hands flat on your chest, just below your collarbones. Apply firm downward pressure with your palms, as if you're anchoring the skin toward your chest. Maintain that hand pressure throughout the movement. Now, slowly tilt your head backward, lifting your chin toward the ceiling. Stop when you feel a stretch across the front of your neck. Hold for 3 seconds. Return to neutral. Repeat 5 times. Then add rotation. From neutral, maintaining hand pressure. Slowly turn your head to the right, trying to look over your right shoulder. Hold 2 seconds. Return to center. Repeat to the left. 5 times each direction. The hand pressure prevents the platysma from shortening as you move. It forces the muscle to lengthen under load, exactly how chronic tension releases. Notice any subtle warmth in the front of your neck after those movements. That's increased circulation through vessels that were partially restricted. Your body responding immediately. Now, this next technique, I'll be honest, it raised my own eyebrows the first time I saw it. It looks almost silly, but the physiology behind it is elegant. Your tongue is attached to the hyoid bone, a small U-shaped bone floating in the middle of your neck. That bone serves as an anchor for multiple muscle groups, including ones that directly influence the position of your larynx and the fascial sheath around your jugular veins. When you rotate your tongue inside your mouth while simultaneously rotating your head, you create a compound movement that mobilizes the hyoid and releases tension in the suprahyoid and infrahyoid muscles, structures that pull on the same fascial network as your jugular veins. A study from Tokyo's Kyorin University found that combined tongue and neck movement significantly reduced resistance in internal jugular venous flow in participants with measured cervical tension. The effect was immediate and measurable within 3 minutes. Not 3 weeks, 3 minutes. That's acute real-time physiological change. Tension hides where you never think to look. Here's exactly how to do it. Sit upright. Close your mouth gently. Don't clench your jaw. Begin rotating your tongue in slow circles inside your closed mouth. Large, deliberate circles clockwise. Move slowly. About 1 full rotation every 2 seconds. While your tongue is rotating clockwise, simultaneously begin slowly rotating your head in the opposite direction, counterclockwise. Keep the head rotation smooth, within comfortable range. You're not stretching, just moving. Continue for 30 seconds. Then reverse both directions, tongue counterclockwise, head clockwise. Another 30 seconds, 2 to 3 sets once per day, preferably in the morning. This looks simple, but do it with genuine attention, and you'll feel a change in cervical tension within your first session. If you don't feel anything the first time, check that your head rotation is truly slow and deliberate. Most people rush it. Everything I've shown you so far addresses the structural side, the mechanical compression of vessels. But there's a second mechanism running in parallel, and if you ignore it, these exercises will work at maybe half their potential. That mechanism is your autonomic nervous system, your sympathetic nervous system. The fight or flight response is a potent vasoconstrictor. When it's chronically elevated, it tells blood vessels to narrow. Every blood vessel, including the ones in your neck. Many people live with chronically elevated sympathetic tone. Deadlines, financial pressure, the accumulated weight of decades of responsibility. Their bodies react as if there's a physical threat 24/7. Vessel walls stay semi-contracted. Blood pressure stays elevated as a new baseline. The parasympathetic system, rest and repair, is its direct counterbalance, and there's a reliable, immediate way to activate it. controlled breathing that directly stimulates the vagus nerve. It's called box breathing. 4 phases, 10 seconds each, 40 seconds total per cycle. Phase 1. Inhale slowly through your nose for 10 seconds. Count to 10 in your head. Phase 2. Hold with lungs full for 10 seconds. Gentle hold, no straining. Phase 3. Exhale slowly through your mouth for 10 full seconds. Empty your lungs completely by the end. Phase 4. Hold with lungs empty for 10 seconds. Relax your abdomen completely. Repeat the cycle 5 times. Total time, 3 minutes and 20 seconds. Do this once in the morning before the exercises and once in the evening before sleep. If your blood pressure tends to spike in the morning specifically, do it before getting out of bed. The mechanism is direct. Slow, extended exhalation stimulates the vagus nerve. The vagus nerve signals the heart to slow its rate, signals blood vessels to dilate, signals the adrenal glands to reduce stress hormone output. It's a biological off switch for the sympathetic stress response. 1. You can activate intentionally anytime. Some people following this protocol find their morning blood pressure readings drop by 8 to 12 points within 2 weeks from the breathing alone. Not a cure, a daily recalibration that compounds over time. Now stop. I need to tell you something crucial, and this is why I asked you to stay until this point. Roughly half the people who try this protocol will see limited results. Not because of the exercises don't work, but because of one specific error in how they apply them. The exercises must be done in the correct sequence. The sequence matters because each muscle group is anatomically layered on top of the next. If you start with the deep scaling work before releasing the platysma and SCM, you're trying to mobilize a deep structure while the superficial layers are still locked. The body resists. You get partial release at best, sometimes increased tension as the muscles brace against each other. The correct order is this: box breathing first, 5 cycles to shift your nervous system out of sympathetic dominance before any physical work. Then the platysma, then the sternocleidomastoid, then the scalenes, then the tongue rotation last, as the integrating movement that works across all layers simultaneously, surface to deep, nervous system first, always. That's the sequence. There's a second error, and this one is even more common. People feel improvement after 3 or 4 days and stop. The structural tension in these muscles built up over years, possibly decades. 3 days of exercises loosens only the surface layer. The deeper fascial and muscular layers need 3 to 4 weeks of consistent daily practice to genuinely remodel. The protocol is not difficult. It takes about 15 minutes total, but it requires consistency that most people abandon at precisely the wrong moment, right when it's starting to work. Do the full sequence in order every single day for 30 days before forming any conclusions about the results. And there it is, the fatal mistake I mentioned at the beginning. Not a missing supplement, not a wrong technique. Sequence and consistency. That's what separates the people who see real changes from the people who say it didn't work. Tell me in the comments which of these 5 exercises surprised you the most. I want to know because the tongue rotation gets the strongest reactions, either deep skepticism or an immediate whoa, something just shifted. Which camp are you in after trying it today? And if this video explained something your doctor never had time to explain, something that actually changes how you understand your own body, then hit the like button. The algorithm decides whether other people in the same situation ever see this information. Every like is a direct vote for this to reach someone who needs it. One final thought. Everything in this video, the exercises, the breathing, the water protocol, works alongside your current treatment, not against it. If you are on blood pressure medication, do not stop taking it. That is not the goal. The goal is to give your body the tools to address the underlying mechanical restriction while your medication manages the numbers in the short term. As vessels decompress, as blood flow improves, as sympathetic tone calms down through consistent practice, many people find that their physician naturally adjusts their dosage at the next checkup. Not because they asked, but because the readings changed on their own. That conversation happens with your doctor based on your numbers, based on your history. I've worked with patients who followed this protocol consistently. Water, breathing, correct sequence, 30 days, and came back for follow-up appointments with readings that genuinely surprised them. That's the outcome we're working toward. The body is not broken. In most cases, it is compensating. The work is to remove what it's compensating for. Subscribe to Winds of Thought if you want to continue this work. Next week, I'm covering the specific inflammatory dietary pattern that increases cervical muscle tension from the inside, the connection between chronic gut inflammation and neck vessel restriction that nobody draws because it doesn't look like a heart problem on paper. It looks like a diet problem, but the pressure is where you feel it. See you there.